Our response to the recommendations of the confidential inquiry will be published this Friday. It set out some of the steps being taken to deliver improvements. So it includes NHS England will appoint a National Clinical Director for Learning Disabilities to help improve the experience people receive in care. That in itself is really important, having a national person focused on the care of people with learning disabilities. We will use the government's information strategy for health and care to drive improvements in the way we identify people with learning disabilities and better respond to their needs. We propose linking data about cause of death with other information to better understand and respond to premature mortality among people with learning disabilities. We will use local mortality data on people with learning disabilities to inform joint strategic needs assessments and joint health and wellbeing strategies. And over all of that, in the Health and Social Care Act, we have set up a new specific statutory duty on the Secretary of State, on NHS England, and on clinical commissioning groups, with the aim of focusing on reducing inequalities throughout the health service, in both access to services and, critically, in outcomes achieved. This will be an enormously powerful tool in addressing very well evidenced health inequalities which people with learning disabilities face. And we will transform care and support through the Care Bill so that everyone can, first of all, plan and prepare for their care needs, secondly, access high quality care when they need it, and thirdly, exercise choice and control, critically control, putting individuals and their families in charge over the care that they receive. And we're also ensuring that care and support is built around the needs, goals and wishes of people who need care and their carers. Now, we've put a duty on local authorities and CCGs through health and wellbeing boards to prepare a joint strategic needs assessment to address the needs of people with learning disabilities. Health and wellbeing boards are required to involve local people and wider partners in the preparation of those assessments and their strategies. Now, just finally, I wanted to just mention the spending review that Jim mentioned in his introduction. This is a £3.8 billion pool of money, and it will be used to, in effect, bring health and social care together. Many of us, I'm sure many of you in this room, have campaigned for a long time to integrate two disparate systems that makes no sense in terms of the interests of the patient or the service user. The only way that local areas can access that money is first of all to come up with a clear plan that delivers integrated care, and secondly, the remainder of the money will only come if results are delivered. So it will absolutely focus people's minds on achieving improvements through integrating those two disparate services. I think it's a historic opportunity to change the way in which the health and care system operates. I'm a passionate believer in the principle of integrated care. Too often our system is completely fragmented, and individuals, often the most vulnerable people, fall through the cracks because the focus is on the needs of the institution, not the needs of the individual patient. That concept has to change, and I think this is a fantastic opportunity. We've also announced that we invited expressions of interest for local areas to become pioneers in really pushing the boundaries of integrated care. And we had a 6-week period for expressions of interest to be put forward. That period closed a week ago, and I've been advised that we might have about 35 areas come forward with plans. In the end, we had 99 areas put forward proposals to become pioneers. And to me, this just demonstrates that we're unleashing an energy and a desire to do things differently, to create in a way a shared vision of a better, more rational system that uses the money more effectively to deliver better care for people who need it.